11 o'clock. We're going to get started. I know the screen says Donna. I am not Donna. I am Cindy. I still work with PATH, Positive Approach to Teen Health. I work with the Positive Potential program. I just started here in December. This is my first lunch table, so I'm super excited, and I'm hosting in place of Donna. She's in spring break, having fun. Today we have with us, I'm so excited. I actually got to meet these ladies in person yesterday. We have Betsy and Carly. They work for the Hub Coalition of Porter County. Betsy is the community coordinator and has worked in the prevention field since 2021. In working in the prevention field, she has coordinated 4 drug prevention coalitions and is a nationally trained instructor through the Council of Mental Well-Being, where she conducts mental health first aid for adults and teens. And so does Carly. Carly is the project director and has been with the agency since January of 2019. Carly has completed the Addictions Intervention graduate program through Indiana University. And as I said, she is also nationally trained instructor through the Council of Mental Well-Being. Prior to prevention, Betsy was actually a nurse, still an LPN. And Carly, you worked for the Porter County Community Advocacy for survivors of intimate partner violence. Is that correct?
Yeah, I was an advocate for victims of intimate partner violence. Yep.
Awesome. So you guys have been doing wonderful work for our community for quite some time now, but I am going to go ahead and give it over to you ladies. Excited to get started.
All right. We'll go ahead and share my screen here, and then we will move forward. So thank you guys for joining us today. As you know, we're going to be discussing THC and the effects on youth. A little bit about Hub Coalition of Porter County. We were founded in 1989, and since then, we've been providing prevention to the community. We are one of 92 counties that are designated as the local coordinating council, and we're responsible for overseeing the distribution of court-collected countermeasure fees. When we collect the state collects these fees, the county collects these fees, and then we distribute them amongst our community to different partners who apply for different funding sources. So these fees go towards prevention and treatment strategies, and we currently work towards reducing substance use and misuse and associated negative consequences through the community. We do that by leading coalitions. So we currently have a coalition in Chesterton, a coalition in Portage, and then a county coalition as well. We also partner with other coalitions in our community. Our efforts are focused on community education, substance misuse awareness, and providing prevention programs to youth throughout the county. And so today, doing presentations like this is really encompassed by the mission that we have to educate our community on all of the substances that can be misused, but as we know, THC is something that's been on the rise for some time. So we've already been introduced. I'm Carly. Betsy will be popping on here. We'll be kind of sharing the time here presenting, so you'll see Betsy in a little bit. I think we've covered pretty much everything, so thank you for introducing me. So we'll be addressing 4 main areas today. THC and what it is and how it's consumed. We'll discuss short-term effects of THC, risk associated with youth use, and then decreasing youth use. So what we can do to shift the increase of youth that we see going on. So we'll go ahead and dive in and talk a little bit about the brain. And so Betsy's going to go ahead and take it over from here and tell you all a little bit about how it impacts the brain.
That's right. Thank you guys for joining us today. I always feel that the more you know about what's going on with your body, the better. So we're going to start off with what is THC? THC is composed of more than 500 chemicals. THC's chemical structure similar to natural endocannabinoids, which is a mouthful, which we'll talk about more. And it is part of a larger endocannabinoid system that provides other works with neurotransmitters. They are naturally occurring in the body. They are lipid based. And because THC is so similar to these endocannabinoids, they are able to latch on to the endocannabinoid system and kind of like rewire it. And we'll talk about how THC is lipid based and how that comes into play. So we're going to talk about how marijuana or THC affects the brain and our body, different routes and forms, how it is metabolized, and what happens when you stop using the substances of THC or marijuana. So I like to think of the brain as under construction. Growth primarily refers to the increase of the number and size of brain cells or neurons, as well as the formation of the connections. And that all happens until around age 10. The brain has typically reached its full size in terms of structure, with most of the neurons and major neural pathways established. So that becomes very concerning when we think about first age of use. So I know here in our area, first age of use is 10 and a half. So we're thinking that the brain sometimes isn't even done growing by that point, and we're introducing substances. When we talk about development, development usually goes into about age 25. And that encompasses a broader range of process beyond mere growth. It involves refining and fine tuning neural circuits, pruning anything that isn't working or unnecessary. A lot of factors go into that: genetics, environmental experience, such as learning, social interactions, and exposure to stimuli. Again, all those processes can be greatly hindered by substances like marijuana. So the core things that we look at is retrieval, learning, memory, mood, and motivation. Marijuana is able to affect the brain because it can, again, attach to those endocannabinoids, as previously stated. ECS, which is the system, is a sophisticated cell signaling network that regulates various bodily functions. It was first identified in the early 1900s. Before then, they didn't really realize what it was that played this crucial role in maintaining homeostasis in the brain. The endocannabinoids bind to these receptors through your body, predominantly found in the central nervous system. The endocannabinoid system influences a wide range of processes, including sleep, mood, appetite, memory, reproductive and fertility, inflammation and immune responses, learning, motor control, cardiovascular function, bone growth and remodeling, liver function, stress regulation, skin and nerve functions. Again, all these are done by the endocannabinoid systems and with the sole role of maintaining stability. So when you have introduced the THC, which connects is in there, again, it disrupts everything. For example, with sleep, what it does is that it signals your brain that you are awake when you're actually sleeping. So your body doesn't get into the proper REM cycle, again, causing havoc. So I like to look at it as, it's our own health and safety team. The system is, again, wired. It is making sure during this age that it is wired correctly. And these wires are supposed to maintain for the rest of your life. They repair damaged cells and make sure that connections are right. And our body naturally produces this chemical. This is why when we flood our system with cannabis, it is like pouring a bucket of salt onto your food instead of a pinch. The more you get flooded of your system also increases your risk of issues like psychosis when you're using THC. It also floods the system with dopamine and norepinephrine, which again can lead to euphoria, pain modulation, and increased anxiety. Less information gets saved as memories, making it harder to learn new information, makes it harder to concentrate and make decisions. Motivation decreases. Teens feel detached and disinterested, which then leads to decreased mood, which is struggling to regulate itself with the THC use. Analogy I like to use, especially when working with youth, is say you have a computer or gaming system, and that's your brain. When you apply THC, it overloads the system, making it not work properly. You can't save any of your work, or if it's a gaming system, you've spent all this time working really hard on a game and nothing has saved. Your progress is just gone. Not to mention that it runs extremely slow. So that's a good analogy that I like to use for youth to explain what THC is doing to their brain. So now we're going to go into what exactly it looks like, and some of the forms, routes of use, and how the body metabolizes it. So for a lot of people, I mean, I think a lot of people see this part. They may not have seen a more mature plant. I know Carly and I were talking about that she wasn't sure on how that process all got started, but so this is a plant at 6 weeks. This is a mature plant. And again, this is in its more simplest form. I will touch on all the ways it can be used, but I will go in more depth on routes that are most common. So to begin with, we have the oral products, um, oral ingestion. It affects time depends on several factors, including the concentration. There's more and more stuff coming out with different concentrations, your metabolism. Usually the onset of the peak of like euphoria is 1 to 2 hours and may last 4 to 8 hours. Maximum levels of THC in your blood may take 1 to 5 hours, and that's just with a single use, not someone that has consistently used. Another route that we have is transdermal. Onset is approximately 30 minutes, so it's really, really fast. Effects can last up to 48 hours. It avoids first pass of metabolism. And again, the patch goes right on the skin. Most times you're going to see that with chemotherapy patients. It's not something we see, excuse me, a whole lot in our youth. Next one is IV. Its onset is less than 5 minutes. Again, it avoids first pass of metabolism. This one is not used a whole lot because of acute paranoia, schizophrenia-like symptoms, and cognitive deficits. Next, we have transmucosal. Onset is again really fast, 5 to 30 minutes, can last 2 to 4 hours. And we see that now with sublingual drops for people that are struggling with MS. The next is rectal. Onset is for rectal is faster than oral. Effects peak within 2 to 8 hours. Again, they avoid first pass of metabolism. Usually it's branded under Marinol or Marinol suppositories, and they are used to treat nausea and vomiting caused by cancer and chemotherapy. It is usually used when other drugs to control nausea and vomiting have not been successful. Also used to treat weight loss in for people with appetite issues, patients with HIV, anorexia, cancer chemotherapy that have induced nausea and vomiting. And then it's branded under a lot of things for an appetite stimulant. And then we have the most common route used is smoking and inhalation. You'll see it in various forms: vaping, dabbing, butane, hash oil. They also have shatter, and that peaks at about 6 to 10 minutes, and effects last 2 to 3 hours. With smoking, though, you also have the release of 100 highly carcinogenic compounds and over 2,000 compounds in total. The reason I like to educate everyone on all the routes and stuff is that even though smoking or vaping or edibles is the most common one right now, that might change later down the road. So I always like to educate people on all the various different routes so you can be prepared on whatever trends start to happen. So we know that it some pass through the body right away. They avoid the digestive system, but most typically, when you're going to use anything, because it is very lipid based, it's going to be stored in your heart, liver, brain, and lungs. Concentrations remain in the brain after longer periods than the blood. THC rapidly comes across the placenta, and THC crosses into breast milk as well. The liver, I always say worker of the month because it has to metabolize all these things. No matter what the route is, your liver is going to metabolize all of the components of the THC. Um, mm, Feces is the primary way that it's excreted. Then you also have urine. You can find it in sweat, saliva, and hair. Something I'd like to point out is, again, we know that it binds to lipoproteins. And why that's important is the fattiest organ that you have in your body is your brain. So the majority of your THC concentration is going to be in your brain, but then also the second is your reproductive organs. So your ovaries or your testicles is going to have a high concentration, which can lead to issues down the road. Um, and I say, like, on average, that's like, this is more like occasional use. It comes into play when you are like a daily heavy user. So next we're going to talk about withdrawal, and we're going to start off with short term. So this is somebody that, occasionally or infrequently smokes, not like a daily or almost everyday user. So on the day one, you might have headache, body aches, anger, sweating, nervousness, nausea, depressed mood, difficulty to getting to sleep, and strange dreams or nightmares. And again, this is somebody that, I mean, this can happen even if you've only smoked once or twice in a short period of time. This is not a long period use, and these things can happen. By day 3 is when anxiety and irritability peak. Sleep disturbances continues to worsen. Again, as we talked about, THC can wreak havoc on your sleep because it tricks your brain into thinking it's awake when it's not. Day 4, most will go back to baseline and brain function will return to normal. On the flip side of that, if you are, again, a daily or near daily user, and then of course, age of brain matters and comes into effect. On day 5 to 7, statistically, most people who try to quit using marijuana relapse. So day 5 to 7 is really important when you have somebody that is trying to stop using marijuana. And then by day 28, most symptoms will subside. There still may be some long-term effects depending on the person. And then again, when they first started using. So that's why it's really important when you are starting to use in an early age, you're going to see a lot more of those long-term effects because of the havoc that you put in when all those connections and neural pathways and prunings were all happening at that vital time. All right, Carly, take it away.
Thanks, Betsy. All right, so go ahead and get this up. Okay, so now we know a little bit about what THC is, and I'm going to move into sharing what the data shows us right now in terms of use among youth. So marijuana is the only substance that has not decreased in average age of first use since 2015, according to the Indiana Youth Survey. A contributing factor to this could be community norms that include low perception of harm. Legalization in states around us can also contribute to perception of harm and youth feeling that the using marijuana is not as dangerous. This data was pulled from the Indiana Youth Survey from 2022. And here you can see the mean of age of first use was 13.8, among 6th through 12th graders. And then that's fairly consistent from 2015 to 2022. If you break down age of first use by grade level in 2022, you'll see that in 6th grade, youth reported age of first use being 11 years old. 9th grader students reported age of first use as 13 years old, and 12th grade students reported age of first use as 15 years old. So this is only slightly higher than the age of first use among cigarettes, vapes, and alcohol, but it still is the highest substance that they're reporting. So what does this mean? This indicates that the introduction of marijuana is beginning at a younger age. So if we look at our 12th graders in 2022, they tried marijuana for the first time around 10th grade. And then our 6th graders in 2022 tried marijuana for the first time around 6th grade. So this means that in our 2028 graduating class, they'll have tried marijuana 4 grades earlier than the 2022 graduating class. And it's not, at this point, we'll have the new data from the Indiana Youth Survey. They're surveying here in the spring of 2024. So we're hoping to have it by the end of 2024. So with that 2-year gap, we'll see if the trends have shifted down or up. Based on a lot of knowledge I've gained throughout working in prevention, my suspicion is that we'll see that the trend is still going up or that we'll see that youth are still using at a younger age. So probably sticking around that 13.8, maybe even going as low as 10.5, since that's the age of first use of any substance on average. So youth who reported using marijuana in the past year indicated that they most often got it from a friend. The top 3 methods of obtaining this was from a friend, some other way, or at a party. As you can see from this chart that you have in front of you, not all students reported using marijuana. However, as use becomes more normalized, I believe this will impact the rates, and then we'll see that increase of use going up. So what does this mean? 17.4% of 12th grade students used marijuana in the previous year, and they most commonly got it from friends. With earlier initiation of use, we'll likely see that percentage of 12th grade students using marijuana rise as we move in with that 2028 graduating class. And then looking a little closer at sources of obtaining marijuana, we see that with this chart here, the Indiana Youth Survey for all of Indiana. So we usually can get local data, but sometimes we look at the state data as well. So for all of Indiana, we see that youth get marijuana more often from their parents with permission than when they get it from their parents without permission. This pattern occurs once youth enter high school. So you'll see here that 7th and 8th grade, they're getting it more frequently from parents without permission. And then once we get into 9th grade, that's when we start to see that parents are allowing them to use the marijuana, and that's how they're obtaining it. Now, of course, this isn't the way that they're getting it most frequently, but it's still something we need to look at. And for us as preventionists, something we need to be aware of so that we can be educating parents on why THC is harmful to their youth. So Indiana Youth Survey data specific to Porter County reflects a similar dynamic. However, Porter County data shows that parents give it to their 11th graders and 12th graders at a rate of 2.1 and 1.4% respectively. So these rates are slightly higher than the rates we see at the state level. Here you'll see a graph, and this is from 2018 study, Drug Use Among Youth, that examined 17,000 youth responses from the National Survey on Drug Use and Health. This determined that teens who used marijuana in the past 30 days also indicated increased use of other substances compared to peers who did not use marijuana in the past 30 days. This graph and similar data can be found at onechoiceprevention.org. And you'll see that throughout the presentation. I've put my sources down at the bottom of the slide, but if you want us to provide you a list of them as well, we can do that. You just need to let Cynthia know, and then she'll let us know. So, but yeah, this is something I found really concerning, because a lot of times people say, well, there's Just because youth is using marijuana doesn't mean they're going to use other things. And I can't say that it's necessarily marijuana use is causation for these other substances, but we do see that there's correlation that youth who use marijuana have a higher likelihood of using other substances. So we work a lot with Overdose Lifeline, which is a well-established prevention agency in Indiana, and they have shared that a person drinking or using substances before the age of 15 is 5 times more likely to become dependent on drugs and alcohol as an adult. And also that children of parents with dependence are 4 times more likely to develop the disease. So this can be due to both genetic disposition and behavioral dynamics within the family. Things like family normalization of substance use. So that might look like introducing alcohol to their youth before the age of 21, poor coping mechanisms within the family, or maybe stigmatization of getting help for mental health treatment. We know that it's not uncommon for youth to treat their mental health challenges through using substances. And so if their parents are modeling that same behavior, it's a bit more likely for them to do it as well. So how do you share all of this information with youth? So we know how THC use and THC use impacts the brain and the development of the brain. We also see some pretty alarming statistics about youth use. So how are we going to let youth know and educate them about this concern? So I have a couple of resources here for you guys. I will go ahead and share a little bit of information about them, but feel free to take a picture and grab these resources. So Talk They Hear You is a national campaign for parents or trusted adults that has tips on how to speak to children. So there's a free mobile app that you can download. I downloaded it on my phone just to kind of test it out, and it's very simple to use. It's a resource that provides talking points for potential questions and tips on how to initiate conversation. When we think about prevention, I like to say prevention starts at home. It starts with us as adults being educated and then talking with our children about the impacts of substance use, specifically as we're talking about today, THC. Talk They Hear You even goes as far as providing tips on starting conversations in specific settings, like at dinner time, in the car, before a child's first sleepover, before prom night. So they kind of take life events and then the more casual days as well. And they give you points on how to introduce conversation in those moments. One thing we know about youth is youth love to be educated at this point, which I think is so wonderful. You know, we've come into an era where there's education and resources at our fingertips. And so youth really take advantage of that. So this is a really great resource, learn.genetics. It's a genetic science learning center that offers articles, interactive learning tools, and videos. I went on there and checked out this really cool simulation they had where they have like a lab, and you pick up a mouse from this test cage and it's consumed a certain substance, and then it educates them on that substance. And I just thought it was kind of a fun way to learn and then also interact. So youth like to be informed, and this is a way for them to learn at their own pace and will allow their parents the opportunity to initiate conversations about what the child's learning as well. A lot of prevention is just talking with the youth. Another really great resource that's geared towards parents is Every Brain Matters. This website was founded by a mother who had a child that struggled with dependence of marijuana. And so she partnered with Smart Approaches to Marijuana, which is a national agency who does a lot of education and policy work surrounding marijuana. And they created this parent-driven site. So you can find articles that are based in science as well as tips for advocacy at that site. So these are just a few of the resources that we know. With Betsy and I working in prevention, we have a lot of resources at our fingertips. So if you wanted to reach out after to us, we would be happy to hear from you and we can provide you other resources. I believe at the very end of the presentation, we have our emails listed. So what are some other risks? As we begin to discuss the risks to youth using THC, it's important to highlight how potency plays a role. We know that there's been a very, very large increase in potency over the years. So in 1995, between 1995 and 2021, the average THC percentage of marijuana flower more than quadrupled from 3.9% to 15.3%. This increase in potency over a couple of decades is something that we're concerned about as preventionists and something we all need to be paying attention to. Future estimates show that the potency of THC marijuana flower will rise from 18% or rise to 18% by 2027. So that was talking about the marijuana in its flower form. So we also have seen with the legalization of marijuana, we see these very high potency THC concentrates. In 2017, THC concentrates had an average THC potency of 55.7%. And today, a lot of retailers promote and profit from products that contain 95 to 99% potency. Currently, the method of use that youth use most frequently is electronic vaping devices, as Betsy shared. These are also known as vapes, and these contain these high concentration levels, or can contain them. Unfortunately, access to these high potency concentrations are fairly easy to have with legalization. Here in Porter County, we have legalization of marijuana for recreational use on both sides of kind of where we're at, and our youth are not having difficulty getting a hold of these concentrates. I was working on a blog for our website at one point, and so I went onto a website to see like what's the process. So if you go onto one of these websites that sells, the only thing they do is ask you, are you 21 or older? I mean, that is for me very concerning as a parent, because that's not much of a safeguard for my youth when we think about what the process looks like for youth potentially getting a hold of this. So you can find out more information about the THC potency on learnaboutsam.org and go into their resources page. In recent years, the United States has seen a significant shift in marijuana consumption patterns due to the increase of potency in marijuana products. We see higher potency products are associated with the rise in daily and near daily use of marijuana. So Colorado saw an increase in marijuana associated emergency department visits after non-medical marijuana legalization in 2012. And from 2006 to 2018, Colorado saw an increase of 341% in emergency department visits associated to marijuana use. Concerningly, we see a large portion of these visits from kids. A 2021 Harvard Health publication shared that between 2017 and 2019, there were 4,172 calls to regional poison control centers about exposure to cannabis in babies and children through age 9. The National Poison Data System reported that 28,630 people called poison control from January 2017 to December 2019, and 27% were patients under 10 years old, and 34.5% were patients in the 10 to 20 years age range. This means that 61.5% of calls were for people 20 and younger. Non-flower cannabis products like vapes and edibles are a heightened concern because they were the most common cause for reported poisoning. A 2022 publication from Open Journal of Prevention Medicine states that driving after cannabis use was more prevalent in legal cannabis states. Additionally, protective attitudes related to cannabis use and driving was more prevalent. So people felt they had attitudes that were more favorable to cannabis use and driving. Shockingly, they determined that risk perceptions were low for cannabis, lower than for the use of alcohol and driving. So how does this kind of tie into what we're talking about today? We see that high potency is a problem. We see that poison control calls go up. That means that we need to educate ourselves about safety surrounding marijuana. So if we're talking about edibles, we want to make sure if we're talking with a friend or family member and they're somebody who partakes, we're having conversations like, are you storing that in a safe way? Ideally, you know, in Indiana and federally, marijuana is not legal, so we wouldn't be having to have those conversations at all. But if we do find ourselves in that position, we want to talk about safe storage for the sake of keeping our youth safe. The 2022 JAMA publication, Association of High Potency Cannabis Use with Mental Health and Substance Use in Adolescents, found evidence suggesting that the use of high potency cannabis is associated with mental health and addiction. Limiting the availability of high potency cannabis may be associated with a reduction in the number of individuals who develop cannabis use disorder, the prevention of cannabis use from escalating to irregular behavior, and reduction in the risk of mental health disorder, including anxiety disorder and psychotic experiences. So as Betsy's shared earlier, you know, the way that this impacts our brain, it can bring on mental health challenges. And so we need to be educating people, make sure that they're aware that this is a risk if they're choosing to consume. A 2023 publication, U.S. Trends in the Association of Suicide Ideation Behaviors with Marijuana Use Among Adolescents, aged 12 to 17, and differences by gender and race ethnicity, found that between 2015 and 2019, suicide ideation and behaviors increased for adolescents that used marijuana. So as marijuana is legalized in more states, public health efforts are needed to curb increases in marijuana use among adolescents. We know when we start to normalize behavior, adolescents are more likely to partake. So as an example, alcohol is legal. And so, you know, we have a higher risk for youth using it, just like vaping devices. You can visit the National Marijuana Initiative at thenmi.org to find a lot of current peer-reviewed articles on the impact of marijuana use. I understand that a lot of times people just don't know where to start when they want to learn more. And so that's a really great resource, and everything that they post on their website is peer-reviewed. It's well established. It's with journals of medicine. So it's a really, really solid resource to refer to. So how is driving under the influence kind of affected here? Driving under the influence of THC is perceived to be less dangerous, like I mentioned. So even though research supports that THC impairs our motor coordination, our motor performance, our cognitive function, our decision-making skills, there's still this perception that it's not as dangerous to drive under the influence of THC than it is alcohol. So the 2021 Traffic Safety Culture Index reported that 100% of 19 to 24-year-olds understood that driving while over the legal limit for alcohol is extremely or very dangerous. They only believed that only 63% believed that driving under the influence of marijuana was extremely or very dangerous. So this kind of shows that we have a bit of a ways to go in education. We know that when somebody consumes THC, their motor skills are impacted. Their ability to make decisions quickly is impacted. And so we really need to start having these education pieces so that people understand, and we hopefully get to this 100% of perception of youth understanding that, yes, this is actually still dangerous. A 2022 Virginia survey found that 68% of people who used marijuana in the last 3 months claim that marijuana actually makes people safer drivers. So that's just, once again, this is like a perception that we need to be aware of and hopefully educate people with the proper information. If a driver assumes a substance is not intoxicating or dangerous, of course, they're going to be more likely to drive after using it. So perception is really, really important. Colorado drivers convicted of driving under the influence for THC alone in 2018 and 2019 were in crashes over 10 times more frequently than sober drivers. So we have data, right, that supports the impact that this can have. Multiple analysis have reported that the presence of THC doubles the likelihood of the driver being involved in a crash. One area of concern in regards to driving and THC is the limitations for testing acute impairment, meaning determining the time frame in which somebody consumed THC. So we know that THC metabolizes at a slower rate than alcohol, and each person's metabolism varies. And so this means that a person can test positive for THC when they did not use prior to driving. So this could have potentially life-altering consequences, legal consequences that can come along with that as well. And so when we're talking with youth, this is really important. And one of those things we want to, remind them of, that there can be legal impact or life-changing consequences if they choose to partake in marijuana. So what are some of these lifelong impacts in addition to maybe those legal consequences that we might find if they are driving under the influence? Well, according to the National Institute of Drug Abuse, research has shown that marijuana's negative effects on attention, memory, and learning can last for days or weeks after the acute effects of the drug wears off, depending on the person's history with drugs. So someone who smokes marijuana daily may be functioning at a reduced intellectual level most of the time. Considerable evidence shows that students who smoke marijuana have poorer educational outcomes than their non-smoking peers. So studies found marijuana use to be associated with reduced chances of graduation. Several studies also found that there's a linkage to linked to heavy marijuana use to lower income, greater welfare dependence, higher unemployment rates, more involvement with criminal behaviors, and then lower life satisfaction. So I pulled all of that information from the publications that you can see on the screen. Once again, if you'd like us to provide you a list of that stuff, we certainly can do that. So an article published in the Journal of Law, Medicine, and Ethics states that some at-risk individuals, it is highly likely that adolescent cannabis use can meaningfully increase risk of the initiation of opioid use and development of opioid use disorder. So both genetics and environmental factors can play a part in this increased risk, of course, but it's just something to be aware of when we're having these discussions with youth, and also having discussions about their genetic history. So maybe they have a parent or a grandparent who has had a dependence problem where they've had to either go to treatment or have just had to abstain because they've recognized that they have concern with substance use. So we want to have those conversations. We want to make sure we're letting our youth know as well as we can, as much as we can, about their own predispositions to dependence. So this linkage to potential use of increased opioid dependence is also supported by a publication found in the Journal of Adolescent Health that highlights previous alcohol, cigarette, and marijuana use being associated with current abuse of prescription opioids in 18 to 25-year-old men. So interestingly, only marijuana use was associated with subsequent abuse of prescription opioids in young women. I'm not quite sure why there were those, what the changes, why there's alcohol, cigarettes, and marijuana use being associated to opioid use for men and not women, but that'd be something interesting to learn about. I just thought it was important to share that, we see that there is this increased risk and association. So why is it important that we integrate prevention programs? This is why it's important that we integrate prevention programs, we educate our youth, and we make sure that we're providing messaging at youth serving organizations. Okay, so Betsy's going to go ahead and take over, and she's going to go over methods used to decrease youth use. Now that we've talked about some of these, like what it is, how prevalent it is, and the impacts it can have. So I'm going to stop sharing, and Betsy. We can't hear you, Betsy. You're on mute.
My bad. So a lot of you might have heard of this, but first thing we like to look at when we're working with initiatives on prevention are risk and protective factors. Risk factors are aspects of an individual's environment, experiences, or characteristics that increase the likelihood of negative outcomes or problems. Some examples of common risk factors can include poverty, exposure to violence or trauma, substance use in the family, genetic predisposition, lack of parental supervision or support, peer pressure, and poor academic performance. All these factors don't guarantee that there would be a negative outcome, but they raise the probability of such outcomes occurring. And the more risk factors present, again, of course, the higher likelihood of these problems arising. Um, that is something here in Indiana. The Indiana Youth Survey looks at that and lets us know percentages of students with elevated risk scores. So that's something that we can take and look at to see where we're landing. And then protective factors are aspects of an individual's environment, experiences, or characteristics that provide a buffer against these negative effects or risk factors, promoting resilience and positive outcomes. Some examples can include strong family support, positive peer relationships, access to quality education, healthcare, effective coping skills, a supportive community, and opportunities for meaningful involvement or engagement. Something that I thought was interesting on our Indiana Youth Survey, they do ask, do you feel like your community cares about you? And there was a high percentage of our youth that said that they felt that their community did not care about them. So again, that gets flagged as a risk factor. Um, Protective factors can mitigate the impact of risk factors, reducing the likelihood of negative effects, even in the presence of risk. They enhance an individual's ability to adapt, cope, and thrive despite the challenges. Again, we get that data from the Indiana Youth Survey, which is pretty helpful. So I like to use this picture as the rain clouds being the risk, and especially us as coalition members, we try to provide these protective factors in the umbrellas. This kid just has the umbrella. This child here has an umbrella and a raincoat and shoes. Here you have good family support. But then, even with that, some of those protective factors can fail or might not be the right thing for that person. And that's what our, treatment providers and everything is for. But again, the more likelihood that you have these protective factors, the more likely you are for a good outcome. Some examples that we are going to look at is when we look at, especially at like the middle school age, is we have individual factors. So risk factors would be poor impulse control, low harm avoidance, sensation seeking, lack of behavioral self-control, aggressiveness, anxiety, depression. Obviously, mental health plays a huge role in the risk factors. Other diagnoses, early substance use, which we've talked about, the early age of substance being in play. And then again, protective factors for that would be, mastering those academic skills, having a good foundation and support at school, being able to follow rules and behavior at home and school, ability to make friends, good peer relationships, all that stuff as an individual. Then as a family, some risk factors would be permissive parents, parents that think, oh, smoking marijuana isn't that big a deal, or there's worse things that you could be doing. We hear that a lot. A lot of conflict between the parent using at home, low parent even relationships. Again, if there's any kind of adverse childhood experiences happening within the home, substance use among parents and siblings. And then on reverse of that, consistent discipline and having those conversations. Carly and I talk about, again, just having those conversations over and over again with your child. not just once, not just twice, but every day, making sure parents are relating to them their expectations as far as drug use goes, but then also knowing that you're always available to have those conversations gives you more likelihood of a positive outcome. So then again, we look at school and peers. And something I want to point out that Carly mentioned too, we're surrounded by states where it's legal. So that always is a risk factor. There's a higher prevalence getting it from someone else, even at older siblings or peers. And Carly mentioned too, there's not a lot of internet safeguards. On our Indiana Youth Survey, we did have students say that they got it off the internet, delivered right to their house. Um, and then social media plays a fact. If anyone's on Instagram or any other social media platforms, you may have been bombarded with advertisements for some of these products. So that's also a risk factor without the proper education behind it. And then parent permission. There's a higher rate of youth getting marijuana from parents with permission than without. So those again, all risk factors. So that's why in coalition efforts, we prioritize assessing peer and adult attitudes and perceptions, enforcement and access, because by understanding these dynamics, we can identify the risk factors and strategically build protective factors to promote a positive outcome. And that's basic groundwork of what we try to do in our coalitions. And again, as you get into older, the individual, family, and social peer communities kind of increase in gravity. And the relationship between risk and protective factors, we really go into, they really interact in complex ways. For example, a child growing up in poverty, again, is a risk factor, may be more resilient if they have supportive caregivers. Again, a protective factor. Increasing protective factors can help offset the impact of risk factors. Again, interventions aimed at promoting resilience often focus on enhancing protective factors within individuals, families, schools, and communities. The significance of specific risks and protective factors can vary depending on individual circumstances. There's cultural context and developmental stage. What may be a protective in one situation could be a risk factor for another. I've, surveyed several kids where just showing them a picture of the school, for them, the school was a safe place. It was a protective factor. But for some other people, it was a risk factor because it was a place where maybe they were bullied or they didn't have great relationships. So you have to look at that one might be a protective factor for someone else and one other might be a risk factor. Both risk and protective factors can change over time. Interventions and support systems need to adapt to these changes to effectively promote a positive outcome. So again, we're always kind of surveying, asking those questions, and evaluating. Understanding and addressing these factors can inform prevention efforts, interventions, and policies aimed at promoting well-being, positive development across various domains in life. So this is an example of what we see here in our Indiana survey. So it gives us an idea of, for example, this one, it's risk factor scores. So community laws and norms favorable to drug use. So those youth that are at high risk in these grades are this percentile, and low risk are these percentile. And if you're not from this area, you may be able to contact your local coalition or Department of Education to be able to find these numbers. Again, students with elevated risk factor scores have a higher likelihood of substance use and problem behaviors compared to those with low risk factor scores. Again, doesn't guarantee it, it just makes them more at risk. Go Carly.
Carly, you're muted.
It's funny because in my head, I'm like, don't forget to unmute.
You just wanted to
But
make me feel better about when I
that's
was
right.
muted.
You're right, Betsy. So Betsy talks a little bit about risk and protective factors, and something that we know to be a risk factor is social norms. Well, it could be risk or protective, really depending on the social norms, but social norms play a piece in risk and protective factors. So social norms are the perceived and unspoken rules that govern how people interact with each other. The norms can vary from culture to culture and from group to group within a culture. So it's important to note that norms can be actual or perceived. So if a great example of this is in our Indiana Youth Survey, youth perceive their peers using substances at about 50%, when I believe it's closer to about 20% overall. So it might even be a slight bit lower than that. So it's important for us to know what the perception is so that we can understand how social norm may be impacting youth use. It's also important to know that even perceived norms can influence the decisions that the individual makes. So if they perceive that their peers are doing this, they may do it because of that perception, even though in fact their peers aren't. We search for cues on social norms by looking to the opinions and behaviors of others, as well as those expressed in the media. So one thing that I'm always really watching out for is how our media portrays youth use. So I can think of, and I won't name them because I don't want to call anything out, but there's several shows that I've seen that are geared towards a younger audience, and the youth are drinking, they're smoking, they're using marijuana, and it's seen as a very common thread in those shows. And so that's important for us to remember. If we have youth in our home, do we want we should be screening, one, what our children are watching, and two, like, do we want to allow them to watch that show or follow that TikTok person that may be kind of incorporating use as a normative behavior. So when we consider social norms, we have to ask the question, what does our community consider appropriate action surrounding marijuana use? One thing that can be a play in that is like policy. So for instance, we here locally had I can't remember if it was an ordinance or a law, but there was some kind of government associated rule surrounding the closeness of a vape shop to a school. And so we had that violated. And then there was a process in which that THC shop or not THC, the vaping shop had to move to another location. That policy or that ordinance is in place so that our social norms are kind of impacted. We're not having youth come out and see a vaping shop locally right outside of their school system, right outside of their school, because that's going to imply that use is consistent in the community. It's going to imply to them that it's normal and it's okay and it's acceptable because they see it on a daily basis. And so we have to be aware of how those norms can affect our youth and the ordinances and policies that we have going on in our communities. As we see states legalizing marijuana use, I think that we will see social norms shift a bit. That's why it's important that the community be well informed on the impact of marijuana use, especially among youth. Prevention starts at home. And if we can help parents and caregivers set healthy examples and expectations, we will see youth marijuana use reduce. Betsy just went through a really great training, and she learned that over the course of decades, we're seeing that prevention works. Prevention, if it's administered to a community, it will have the impact on reducing that substance. So as community members, how do we change our social norms? First, we have to educate ourselves. So doing things like this, coming to lunch tables, going to seminars, checking out free resources online, like we have something called the Prevention Transfer, can't remember exactly, but it's called PTTC. And it has a ton of trainings for anybody who's interested. So things like that are going to help us educating ourselves by reading peer-reviewed articles and understanding what this actually looks like and how THC can affect our community and our youth. Checking out podcasts that are scientifically informed. So making sure that we're not just listening to because we have a lot of people who have a lot of opinions, but we need to make sure that those opinions are based in fact and science. And so it's important to make sure that we're monitoring the resources that we're taking in and making sure that they're based in science. So those are a couple ways, and then we want to communicate. So we're going to talk to our peers. We're going to let them know what we're learning. We're going to start conversations and share what we know, and do that within our social circles, with our youth, in our professional circles, if that's appropriate for you. And then, of course, we want to take action. So get involved in community-driven groups and initiatives that support youth health. So that's kind of just a way that we can work to change some social norms. Then we also want to look at, I wanted to highlight mentoring, because mentoring is a really, really great protective factor. There's a lot of research that shows if a young person has one mentor, whether that is a mentor who is placed in their life through a mentoring program, or a mentor who's kind of naturally come into their life through, like, say, a loved, trusted adult, like a coach or an aunt or uncle, or if somebody's in the faith-based community, they have a trusted adult there. Those are all considered mentors. So mentoring at its core is guarantees young people that there's someone who cares about them, and it assures them that they're not alone in dealing with their day-to-day challenges, and it makes them feel like they matter. There's a lot of research that shows positive outcomes for youth who have a mentor. So research confirms that quality mentoring relationships have powerful positive effects. This includes a variety of personal, academic, and professional situations. Mentoring enhances personal growth and development and can increase social and economic opportunity as well. One thing that I found extremely interesting is that young people who have higher risk factors are more likely to aspire to attend and to enroll in college if they had a mentor. So they're also more likely to participate in sports and other extracurricular activities. We also have reports that a youth who has a mentor is more likely to take on leadership roles in their school or at their extracurricular activities, and they are more likely to volunteer in their community. So you can see that mentoring is a really great protective factor. And I believe PATH has a mentoring program. There's several other things, Big Brothers Big Sisters. I've heard of Lunch Buddies as a mentoring program. So you can definitely look in your area and find out what programs are available. At the very bottom, I put the mentoring.org website. That is kind of like a nationally recognized mentoring hub, if you will. And so they have a great amount of resources, and you can sign up to be a mentor if you're interested in doing that there. And then Betsy, it's back to you. Let me stop sharing.
You're muted.
We're gonna get this right, I swear.
So close. So which leads me to my favorite is youth-led coalitions. It really ties in kind of like mentoring and these youth coalitions. So youth-led coalitions play a crucial role in substance use prevention and mental health promotions for several reasons. Youth-led coalitions bring an authentic voice to the conversation. Since they represent their peers, they can better understand the challenges and pressures faced by young people regarding substance use and mental health. This authenticity makes their message more relatable and resonate more among their peers. Involving youth in these leadership roles empowers them to take ownership of the issues affecting their communities. It really instills a sense of responsibility and agency and helps foster leadership skills, self-confidence among young people. And then when youth feel empowered to make a difference, they are more likely to actively engage in prevention efforts. Youth-led coalitions are often better equipped to address the cultural nuances and diversity within their communities. They can tailor prevention strategies and messaging to reflect the unique cultural backgrounds, values, and norms of the population they serve. This cultural relevance enhances the effectiveness of the prevention initiatives. Peers exert significant influence on each other's attitudes, behaviors, including substance use and mental health practices. Youth led coalitions leverage the power of peer influence to promote positive behaviors and attitudes. When young people see their peers advocating for healthy choices and seeking support for mental health, it can positively impact their own behaviors and perceptions. Youth led coalitions often bring fresh perspectives and innovative approaches to substance use and prevention and mental health promotion. They are more attuned to emerging trends, obviously, social media influences, digital platforms, which allows them to develop creative and engaging campaigns that resonate with peers. We have a saying, nothing about them without them. Engaging young people in prevention efforts also fosters a sense of civic responsibility and social activism that can have long-term benefits. By empowering youth to advocate for change in their communities, youth-led coalitions contribute to a culture of prevention and wellness that extends way beyond individual initiatives. Involvement in youth-led coalition provides valuable opportunities for skill development, again, leadership, communication, teamwork, problem solving. These experiences equip young people with the tools they need to become effective agents of change, not only in substance use prevention and mental health, but also in other areas of their life. Overall, youth-led coalitions play a vital role in creating supportive environments, fostering resilience, and promoting positive youth development. By amplifying youth voices, these coalitions contribute to more comprehensive and sustainable efforts to address substance use and mental health challenges in the communities. So I was very fortunate enough to have some youth coalitions. There's me right there. um, and these youth groups, it really empowered these students to become leaders and take on an active role in preventing drug and alcohol use. They created and instituted their own projects. They were required to have a part of the ATOD, or alcohol, tobacco, and other drugs, in their community. And they looked at issues such as perception, mental health, school, community environment, along with many other things. They were responsible for collecting their own data on specific areas, and that way they could implement certain projects to help improve those areas that they were working on. All projects use data to show whether positive effects were made. And not only does it help the school and community, but it teaches the students, again, to be leaders, how to communicate and work in small and large group, resolve conflicts, evaluate data, and to be able to track and then present. The things that they were able to accomplishment in our community was amazing. They were also able to go to CADCA, which is a prevention group. They are coming to Chicago actually this summer. They were able to go to Capitol Hill Day and actually talk to many of our state senators and representatives, which then led to follow-up conversations after they got home. And they actually really kind of spearheaded some awesome conversations, which I think are still continuing to this day. They brought in some internet safety speakers and was able to do a great presentation on that, because they felt that was a great component. They provided so many more community events for everybody, and provided engagement. They planted flowers to symbolize Red Ribbon Week. We did more activities where we got the whole community involved, where we would teach skills to other students. We had free movie days because we know that activities obviously is a protective factor. We know sometimes costs are an issue, so to be able to find apply those free activities to youth was invaluable. They also wanted to work on safety, so they collected data by doing a seatbelt check. If you were wearing a seatbelt, you got a Smartie. If you weren't, you got a Dum Dum. and they were able to use that data and apply campaign and measures to be able to combat that. They also did many activities for the elementary schools. So they were going in and being mentors to elementary, but also middle school, and then be able to see the effects from that. They did several mental health. They took over the school for a week during May, Mental Health Month, and they had activities every day. They also were organized free screenings for youth. We also implemented something called an SBIRT, which is a strategic brief intervention and treatment. And because of them, we were able to add that into the beginning of the school year. So every student with parent permission was screened, and it allowed them to be able to recognize maybe some issues before they expanded into some more severe things, and catch people that maybe were afraid to say anything. So I could talk more and more and more all day about the amazing accomplishments that they had, but youth coalitions, they're the ones that get the work done, and they provide amazing protective factors, not only for themselves, but for their peers around them. So they are really a great tool, an asset to your community. So again, if you ever have questions about a youth coalition, you can reach out to me and I can give you all the information. Hey, Carly, you're it.
You
Just
are
go ahead and leave
muted,
that
Carly.
up there, okay? Betsy, that you're just keep sharing. Or did you stop sharing? Already? It doesn't matter. So yeah, we're just here for anybody who has any questions. We'd be happy to answer any right now. As you can see on your screen, there are our emails and our phone number. And we're always happy to expand on what we shared today. I know it's a lot of information, and it's probably kind of we've shared a lot of data, and that can be a lot on the brain. So if you need to kind of just even take that back with you and think it through, and have more questions, we're happy to answer them. So anyways, we'd be happy to answer any questions you might have now.
Yeah, we're actually, if it's okay with you guys, we're gonna take just a short little break, about a 15-minute break. Anybody needs to grab their lunch or heat it up or whatever, and we're gonna go into breakout rooms where you guys can ask each other questions, maybe engage on some of what you've heard today, and then we'll resume promptly at 12:35. And if you guys have any questions or anything you think about in that little break, you guys can ask them if that's okay with you, and then we'll end at 1 o'clock. Okay, so I'm gonna start the breakout rooms now for you. And then again, we're all gonna come back to the main screen. I'll end the breakout rooms at 12:35. We are back. I hope everybody got to grab their lunch or start eating their lunch. We're going to take some time now if you guys have some questions for Betsy or Carla. I think everybody should be back from the breakout room now. So I know I had one question. Teaching positive potential, we do hit on THC and vaping. And I know you guys mentioned it a few times during your presentation about how, we're surrounded by states where it's legal. And I was curious because, it sparked my curiosity more so yesterday, during your guys' meeting of how will, legalization of here in Indiana change our methods of prevention with the youth? How do you think that will play out?
Well, I think one thing that's really important when we're talking about potential legalization is getting ahead of it, right? So like, let's look at our policies that we can put in place, our state, our laws, right? So if we look at legalization, then perhaps ideally I would love to see that we have a component within the law that that requires prevention at a state level, right? So where it would be required in the school system to have this prevention piece in play. So that might shift how we do things a little bit more, because we'd have to maybe bump up some more of our programs. But then certainly when we're talking about like changing social norms, I would say we would need to really look at things like billboards and stuff like that, where we're making sure we're providing sound, real information. Because if you drive into some of the legal states nearby us, you'll see billboards that, use the similar tactics that the tobacco industry used, where it's young adults, and they look like they're having a great time and they're having so much fun, but there's really no messaging on that counterpart of like, okay, so how's the impact? What's the negative impact, right? It just looks like it's a good time and there's no problem with it. So that's one thing we'd probably look at a bit more as well. What do you think, Betsy?
Um, it's interesting, all the data research that I've done, and I've mentioned this to some of our other partners that we work with, the states whose numbers have consistently decreased as far as substance use goes, all have state mandated prevention programs in the school starting kindergarten through 12th grade. So that tells you right there, yes, prevention works. So I think if we had something a little bit more concrete as far as that goes, we would see our numbers move in a positive direction. And then also too, we have a podcast called Matters of Substance, and recently I had my son on, and no prompting from me. He said it still floors me that something that you have to be 21 to buy has no limit or parameters on advertising. And I thought that was such a unique perspective, that that he came up with. And I was like, yeah, there probably should be some limitations on advertising when it comes to something that you have to be 21 or older to buy, or that's not legal in all states. So I think that's also going to be something, hopefully maybe, that they'll look at in the future as we move forward. So, and I hope that there's a change in social norms. I know that there's a lot of it's alcohol. Oh, kids are going to drink it alcohol, and it's just something they do, where it's less of a norm that happens. And some of those kind of start to change, or using alcohol and other substances, so geared towards celebrations. Maybe that starts to shift a little bit. So changing some of those social norms in a different direction. Carly did say too that someone had a question about how to recruit youth. Is that correct?
Yeah, but recruiting youth, not only recruiting them, but also like I guess the pool that was used. And I did share that the examples you gave were from when you were working with a coalition in South
Mhm.
Dakota, that we have the YAC program. I didn't say YAC, but
Mhm.
that's what I
Mhm.
alluded to. And then our marketing group of marketing students that we've been in connection with.
Mhm.
So but if you
Mhm.
could maybe share a bit more about like what your experience was in South Dakota, that would probably be helpful.
Yeah, so as far as our youth coalitions, we had a high school one to begin with. Initially it was just sophomores and juniors, but then we opened it up to freshmen. And by the time I left, granted, my town was only like 5,500 people. I think the high school was just over 400. We had over 50 students in our youth leadership program, which was awesome. And then we were working on expanding it to the middle school, which was fantastic. So our middle school was 5th grade through 8th grade. And our school actually had a mandated prevention program where every quarter students would either take PE, art, computers, or drug prevention. So every student in every grade, 5th through 8th, got to take a session in the drug prevention program. And so with that, we started the youth leadership team, and then our older students would act as our mentors for those younger kids. They would come down and do activities in those drug prevention classes and then help them with some of their activities. When we did recruiting, usually they would have a night where you could come in and check out all the activities and clubs that would be offered. And they usually did that in the spring for the previous year. So we always had a table there. We recruited a lot of like, if there was a 4-H or, um, Boys and Girls Club, any of those kind of activities that you had, we were recruiting there as well. But it was, ours was really geared in the school. There's tons of different ways to do it, but the way that we did it was we knew that the kids are at school. It would be beneficial to have or advisors that are teachers. So we were able to fund and pay for 2 teachers to be permanent advisors. That way they could meet at lunchtime there. The students are right there. If they needed anything, wanted to work on projects, they were all right there at the school. And then I would come in. I was also lucky enough that they gave me a little office to come to the school so I could also work with the students anytime I wanted to. And so I would do sessions with them as well and work on projects. But yeah, and then as far as the middle school goes, or incoming 8th graders, a lot of times schools will have if they're going into being a freshman, they'll have like 8th grade fairs where you can see all the activities that you can do as a high schooler. And so we would recruit that way as well. I know currently that's something we're working on, our current members to go out and recruit other members and then have some kind of like, mixer night where we can get together and kind of promote the program and what we'd like to do and stuff. So
Yeah, that's awesome. I was actually just going to ask, so you guys, towards the end of your presentation, you had called us to action. A lot of us, I think, are parents, or if we're not parents, we're mentors, or we're on this call for a reason, right? Because this interests us, we want to help. So, what things do you guys have in place this year that people can get involved with, or even bring their children or their mentees to?
I would say it depends on your location too, right? So like for us, we we do a lot of different things. One of the really great things that we did in the last year, and I'm hoping we could do kind of towards the fall time, is we did a screening of something called the Addicts Week. It was a documentary that was recorded in Brown County, Indiana. And basically we did like a provider fair at the beginning, a screening, and then a talk with local experts about what we watched. And I thought that was a really great activity to do where parents can bring their kids. We had it open to, yeah, you bring your youth and then have conversations. So finding local resources like that in your community, if you go to your coalition, if you're not here in Porter County, Indiana, you probably have a coalition nearby, maybe not exactly in your community, but close enough that you can be a part of, and join that, because they're going to have all kinds of things, education pieces. They're going to have events, activities that you can go to. If you're looking for something that's maybe more nationally, I know that Smart Approaches to Marijuana, I mentioned that they have like a Parent Action Network, I think is the name of it. So you can get involved in that. It's a coalition of parents who are working to reduce marijuana use specifically. And they're always looking for people, to my understanding. So that would be a great way to get involved. But mostly I would say find your local coalition, find your local group of people. If you don't have a coalition, you can start one. Really, coalitions start at grassroots. It's people who come together and say, we've got this thing going on in our community and we want to shift, we want to make change, and you can come together and do that. We've been lucky that we're the local coordinating council, so we have that was kind of established early on. And that's not true for every state in the United States. That's something that I think is specific to Indiana, having these designated coordinating councils. But coalitions are grassroots and they can get funded. So if you get a coalition together, you get a group of people who are passionate about the cause. There's a ton of support that you can refer to get a coalition running. Specifically, check out CADCA. That's a really great resource. They help communities establish coalitions, build coalitions, expand them, and then also they help when a coalition receives a drug-free community grant. So there's options out there. Check out your coalitions. Those are good. That's going to be your best way to make a change.
And if you are local,
Join us.
we have a coalition in Portage, we have a coalition in Chesterton, and then we have a community-wide one that meets in Valparaiso. And some of the activities we have is in Valparaiso, April 23rd, we're holding an event at the Valparaiso High School called Goggles and Carts. So the kids do driving simulation with alcohol or marijuana goggles, and they try to go through a course. They also do other activities. We're there to provide information. It's all day event and we have volunteers for that. Another thing we're doing is we're doing a team up to clean up. We're going to be cleaning up the areas in South Haven and the parks and the surrounding areas. We also have a take back day in Portage at Rittenhouse where we'll be taking back medication that people can bring in. We have police officers there to take it, but we'll also be able to have conversations. We also do, probably not coffee with the cop, but a beverage with a cop, where we're doing at like a bubble tea place. We're doing smoothies at the school, YMCA. So we hold these to provide engagement with our police officers and us. And we have you come in and we usually give you like a coupon for a drink and try to promote stuff that way. And then in May, we are doing a program in Chesterton called Reality Check, which the 8th grade students play a life-size version of the game of life. And so our component is if they land on our square, we're going to say, you got a DUI or you were caught, vaping or using marijuana. And these are all the consequences that can happen in the game of life. So we're always doing fun activities like that. So if you ever are in the area and want to participate, just give me a shout out and I will lead you in the right direction.
Hey, Carly, or sorry, hey, Betsy, or Carly, both of you.
Yes.
We were just asked to provide the tobacco prevention cessation folks in Indy with information on what every school does with their vapes. Now, I know I asked certain police officers and they give me their confiscated non-THC vapes so that I can use them for educational purposes. And usually they're pretty happy to get rid of them. But do you guys have a comprehensive list of all our schools in Porter County and what they do with the confiscated materials?
No, we don't have a list of it. What I've heard, just like through conversation, a lot of times is it then goes into evidence and then it goes through that process. That's what I most of the time hear.
I'm gonna jump in. I work in LaPorte County. I'm a mental health counselor and I go between the high school and middle school. And I so appreciate this discussion. I've been taking a lot of notes, but to answer your question, Carrie, about vaping, we had gotten all of our school corporations in our counties together to talk about the vaping issue. And one of the things that I shared with the group was we use a program called Vape Educate. In the past, when a student had a vaping violation, we were, I guess, quick to suspend them. And we're getting away from that. We want to try to educate the students because they're so misinformed about vaping. And so when a student at the high school, middle school, they have a vaping violation, I meet with them and I assign the program, Vape Educate. It's an online program. it varies from student to student. It can take them up to 4 hours to complete. And there's 7 units to it, and 1 unit, it does cover vaping THC, and the students have to earn an 80% on the end of each unit quiz to be able to move on to the next. And so I think that has been successful. And so we've been using that probably 3 years now, and it seems to be working. Now, do we have students that have had a second violation? Yeah, but we have a whole step system in place when we have students with vaping violations.
Christine, can I ask you a question about that program? So when that student finishes that online program, and I'm taking you use it more for punitive, like restorative punitive versus prevention for the vaping education in that instance, how do you know they've completed it? Does it send you an email? Do they print out a certificate, or how do you know they achieved the 80%?
Okay, so I'm the person that signs the student up. The administrator will contact me. I sign the student up online. And then at any time while the student is working on the program, I'm able to look up and see exactly where they're at in the program. And so when a student completes the program, they earn a certificate that they've completed it. I get a copy sent to me of the certificate, and then I let the administration know that the student has completed vape ed. We talked about there's a small fee involved for each student, but I find it better that we have a person overseeing it because, we can see exactly where the student is at or whether or not they even started the program. So,
You have no idea how helpful that is at this point in time for us in Porter County right now. We are
Okay.
also working on the same efforts. We do Catch My Breath preventatively, but we're actually looking into more punitive programs for after they get caught. So thank you, because I honestly hadn't heard about that one. So I
yeah,
appreciate that.
and do not hesitate to email me. I'll put my email in the chat and I'll be glad to help you.
That would be fantastic. Thank you.
Mhm.
Yeah, when we talk about, protective and risk factors, there's schools in the area that have a zero tolerance policy. You get caught once and you're expelled for 10 days. And that is a huge risk factor for youth that are already using substances. So we've been working on trying to do more restorative measures, more education, providing even cessation, to keep them in school and surround them with as much education and protective factors as possible, instead of implying more risk factors to them.
Does anybody have any more questions before we end our session today? Well, everybody that registered, if you're participants, you're going to receive an email today with today's recording, a link. And then there's going to be another link of a short evaluation. If you guys can please take a minute or two to just complete that. I think Carly and Betsy actually mentioned getting some data. So that would be great for them too. Feel free to share this link from today's webinar with others. This was incredible. They joke around about information overload, but it was wonderful. It really was. We want to thank you so much for being here with us today, especially Betsy and Carly. Thank you so much for coming on again. I know we had some hiccups last month, but I hope to see you guys at our next Lunch Tables webinar. It's Wednesday, April 24th. Our guest speaker will be Angie Alphin. Hope I said her last name right. She's going to be talking about the effects of stress on today's youth. But I hope you guys enjoy your day. Hopefully the sun will come out or is out wherever you are. Have a good one.